Preventing new HIV infections is a critical aspect of combating the global HIV/AIDS epidemic. While there is no cure for HIV, there are highly effective strategies for preventing transmission of the virus. Some of the most effective HIV prevention methods include safe sex practices. Consistent and correct use of condoms during sexual activity remains one of the most effective ways to prevent HIV transmission. Pre-exposure prophylaxis, or PrEP, is a medication that people at high risk of HIV infection can take daily to prevent HIV. When taken as prescribed, PrEP is highly effective in reducing the risk of HIV infection. Post-exposure prophylaxis, or PEP, is a course of HIV medication that is taken after a potential exposure to HIV. It must be started within 72 hours of exposure to be effective. Needle exchange programs. For people who inject drugs, using sterile needles and syringes for each injection is crucial to prevent HIV transmission. Needle exchange programs provide sterile needles and syringes to people who inject drugs, reducing the risk of sharing contaminated equipment. Mother-to-child transmission prevention. HIV can be transmitted from a mother to her child during pregnancy, childbirth, or breastfeeding. However, with appropriate medical care, including RT for the mother and antiretroviral medication for the infant, the risk of mother-to-child transmission can be reduced to less than 1%. Regular testing. Knowing one's HIV status is essential for both treatment and prevention. Regular HIV testing allows individuals to learn their status and take appropriate steps to protect themselves and their partners.